Yep. I'm Dr. Anthony Corral, C-O-R-R-A-L. Well, I'm a dentist who focuses on dental implantology, both the surgery and the restorative component of it. I've been doing it 17 years. Well, I think Renew is an amazing company. What I love most about Renew is the ability to have a prosthetic and to have a solution for somebody that is both beautiful, functional, very strong, but most importantly, it's affordable. There are a lot of dental implant centers that offer different treatments, but our proprietary product is amazing, and it comes at a price point that's significantly less than the competition. Normally what we have in our industry is a kind of a one size fits all, and that's usually at about the $50,000 price point or more. The product that we're offering is about half of that, and it has very strong function. The science behind it is proven. The proprietary technology is amazing. The doctors are super talented. The doctors are empathetic, and it's just an amazing thing. One of the things that we find out is when somebody sees they have sticker shock. When the treatment that we're offering is about $50,000, they usually cannot get finance for that. There are not lending facilities that are for that, but when you use our product, we can get someone down to about $149 a month for implant supported teeth that are beautiful and are functional, that are strong. So you really can't beat it for $149 a month. It's a 12-year payment plan, $149 a month. We just got, we worked together with a bank that if you have a credit score of over like 550, that we can get financing for you for $149 a month. And that makes it basically affordable for anybody. So they don't no longer have to just wear a denture that's loose. They don't have to wear a denture that's gonna fall out and not give them great support. They're gonna have a prosthetic and teeth that stay in there, that are beautiful, that they can chew. And I mean, for $149 a month, it's not much more than your cell phone bill. When we're looking at a price point in the low $20,000 range, that it can give you a solution, but people still have a hard time with coming up with $20,000, $25,000, even if our product is 60% less than what's out there. What we focus on is finding a way to make the dentistry that they want fit into their budget. And so at $149 a month, it just can't be beat. Well, what I can tell you is that in the past 17 years of my career, I've been doing this type of procedure for about 13 of it. And it has advanced so far, and it advanced so much. But the people who are able to get it in the past, beforehand, up until the last couple of years, I would see about 10 consults. For every 10 consults I see, maybe 1 or 2 would be able to do the treatment, and they would have to pay it in big chunks or right all at once or do a home equity line of credit or really some creative financing. But with what we offer at Renew, it is game changing to be able to offer financing for patients that's $149 a month, makes it affordable, and they get their teeth now. And they get back to having a quality of life now that they can eat and chew and enjoy their life.
What about dentures? What do you say to people who are suffering with dentures, who feel like there's no hope and they're stuck there?
One of the things we find out with people that have been wearing dentures for a long time is that they normally don't go for checkups anymore. Once they're wearing dentures, they feel like their life's over. That's kind of what they have. So most of the time, all the time when somebody's wearing a denture, they begin to lose bone, and their jawbone begins to atrophy or kind of melt away over time. And so those dentures become ill-fitting, and they can rub on the tissue, causes tissue changes or changes of the gum. They can even lead to potential cancer. So what we want to do is we want to tell those people that there is a solution for them, that those dentures, we can change them so that they fit better, that they don't move anymore, they can have teeth, that they can preventatively stop the potential of having a cancer. So Renew we have a great workflow. One of the greatest things about it is that we actually consult with our own medical doctor that works with our office, that is part of our Renew team, so that when a patient comes in, we go through their entire medical record to make sure that they're a great candidate for this. We also do a cone beam CAT scan so we can see the quality and the amount of bone that we have to make sure that our patients are candidates for this procedure. Once that's taken care of and we do this procedure for them, they are actually leaving with teeth the same day. So that's an amazing change. A lot of times you can't leave for them for a few days or a week or even longer, but you get to leave with teeth that day. What I love about Renew is the team itself. So our team is completely dialed in and they're focused on making sure that you have the best experience possible. I'm so happy when I go into the office as one of the doctors and I do the procedure because everyone around me is so professional, they're so empathetic, and they take care of the patients. The reviews that we get on Google, I mean, everything is 5-star. So Renew, we have offices in South Florida and Fort Lauderdale. And so they're very convenient to so much of the people, the demographic in Fort Lauderdale that this procedure works for. And so at Renew, we have everything dialed in. And what I love about it is that we have partners both on the implant side and both on the restorative side of the dentures that really work together with us and work with our proprietary infrastructure of our software, that everything is so seamless and streamlined. It's unlike anything that I've ever been a part of in dentistry in my career. You know, when we're doing cases like this and this procedure with Renew, it is completely digital motivated. So when we're doing these cone beam CAT scans, we marry those 3-dimensional images and the analysis from them along with our proprietary software to construct and design the teeth that go along with it. And so once we marry those two of where we want the teeth to be, along with what the patient has originally, all we need in the middle is where the implants go. And so those implants are designed and placed virtually so that that is digitally manipulated to create precision surgical guides to make surgeries drastically better, less painful, and perfect.